Next, we'll go to Pat Healey with the Laker. Go ahead, Pat.
Hi, for Dr. Strang. You talked about significant negative impact if we don't manage this well. What could some of those significant negative impacts be if Nova Scotians don't manage this well and do our part?
Well, the biggest thing that we have worked all along throughout this pandemic is keeping the spread. I mean, early on, we were focused with no spread, but in the last, the fourth wave, and now it's about keeping the spread to a level that minimizes the level of severe disease. So really our goal, and what I'm concerned about, is if we don't put some restrictions on now, we have really unchecked spread, which then puts people who are at higher risk of severe disease based on age or underlying health condition at risk. And then we already have a health system that has a lot of pressures on it. And if we start to get significant amounts of severe illness from COVID, then we're going to put that health system under even more stress. And if you see what's happened in other provinces, the things you then have to close down to deal with COVID has their own set of impacts on people's health in terms of missed surgeries and all those kind of things. So our goal is really focused on limiting the possibility of a significant amount of severe illness.
Pat, do you have a follow-up question?
Yes, I do. Also for Dr. Strang. If a person was a close contact of, say, the COVID exposure at Waverley Memorial, and they played with their sports team over the weekend, would all those players on the team be determined to be close contact as well?
So you're essentially they're contacts of contacts. It would really depend on then the individual who's the contact about they would need to be getting tested and monitoring themselves for symptoms and appropriate testing as guided by local public health. To determine whether the people they were in contact with were also potentially being exposed. If that's the case, what the example you've given really is that shouldn't happen. If people have been identified as a close contact, then they need to follow public health rules. And if they're fully vaccinated, they need to isolate, and then at least 3 days, 72 hours, take a test, and they have to stay isolated until they get that negative test. Everybody needs to understand that and follow that. And if they're not fully vaccinated, then they have a longer isolation period.